Barb, over to you.
Okay, let me see if we can get some advancing going on here. Okay, screen. So welcome everyone. It's nice to see all of you here and ready to listen in today. Abigail, can you see the screen?
Yes, I can.
Okay. Did it advance for everybody?
Yes.
Okay, great. So once again, welcome. I see we have a fair number of attendees. I'm hoping to have chapter presidents, chapter spokesperson. I can see I have a couple of the ANFP Government Affairs Committee members on. So we're going to learn today how to rally the role of the chapter spokesperson. So for today's takeaways, we want to know what an awesome chapter spokesperson does. And I want to highlight that word awesome because it is really a unique role that we have as ANFP in our state chapters. I like to call it kind of like the quasi cheerleader, brand ambassador, a la carte position. You kind of cover a lot of territory, but you're kind of that go-to in your state for questions related to the CFPP, CDM credential, any legislative stuff that's up on the hill or going on in your own chapters, and also that person that hey, can you help us maybe go out and do a booth somewhere at one of our colleagues in the dietitian world or one of our healthcare associations. So we're going to talk about the awesomeness of how do we get to that awesome. And then the Government Affairs Committee for 2018. In the past, we were called the Legislative Committee. Now we've changed our name to the Government Affairs. We've kind of let down our hair, and now we need some sort of new rallying cry. So I'm going to introduce you to the rallying cry that the Government Affairs Committee, other CDMs from other state chapters, what we're doing at the ANFP national level to promote the credential. And then once again, we talked a little bit about how do you be that cheerleader and that brand ambassador. So we want you guys to walk away from this session all rejuvenized. It's January. Some of us are freezing our tuchuses off, and some of you are happy to be in warm weather. But hopefully this is the rally cry for you to help your chapters take off with the new and exciting regulations and the recognition the CDM credential has attained. So what is awesomeness officially? So a lot of states chapters have your policies and procedures and your bylaws. Those are two requirements that we have from ANFP National. And in our policies and procedures, there should be a job-like description for the spokesperson. ANFP has a wonderful volunteer handbook. It's called the Volunteer 101. It's found in off the ANFP website. Hopefully your chapter has shared when you took over the role of spokesperson what your state chapter's policies and procedures are, describing what the spokesperson's role is. If not, here's the Volunteer 101, and you can get to it off of the Connect site. So once again, you're going to sign into ANFP. We're going to go to the Connect, ANFP Connect. Under Volunteer Resources is where this handbook is. And it has a treasure trove of information, not just about the spokesperson's role, but as a chapter, what is your governance? What do the other positions do? And for those of you that might have done this spokesperson gig for quite some time, I know I'm seasoned in Iowa. I still remain the spokesperson there. And every year I try to go back, and when the board in Iowa reviews the policies and procedures, I like to go back and reread it and see if there's anything that we need to update in our state policies and procedures that might be specific to Iowa. So take a look. Here's your volunteer resource handbook, and there's exactly how to get to it. Also under that volunteer resources, there's a lot of other good information that you can go and take a look at. So if you'd have time, peruse the others as well. This is put out there from ANFP for your benefit. So this screen looks a little busy, and it's the ANFP duties. This is what ANFP has defined as the duties of a spokesperson. And I've kind of plucked from the official handbook some of the duties that I want to kind of talk about and highlight. So the first one is, as a spokesperson, you're chosen hopefully for the role because you have some tendency to be able to express yourself, or you have an interest in politics, or you know your legislators, or maybe you're active in your own community, or you're active in one of the healthcare arenas in for just legislative stuff or regulatory stuff or rulemaking. So that's kind of, you want to have that interest and that drive to go and help influence. It talks about the state lawmakers, our government officials. Also out in the public, maybe it's going out and talking to, strange as it sounds, I've been out and spoke with ARP, our local Iowa chapter of ARP. They wanted some information on nutrition professionals. So, that's a way to go out and become the brand ambassador. Act as public relations, press releases. If you have the opportunity to go into your local newspaper, and maybe Iowa has, the Des Moines Register has thistles and roses, so you can go in and write a column either, disagreeing or agreeing with some legislator, or give an opinion, or a lot of times during National Nursing Home Week in May, newspapers like to have people write articles or to identify. Usually we see nurses and CNAs get promoted. There's no reason why we can't do something about food service workers, or Pride in Food Service Week in February, or we have another opportunity in October when it's healthcare food service. So take those opportunities you have to go out and express yourself written. You could maybe volunteer a blog. Sometimes it's good to volunteer like maybe a recipe and then talk a little bit about what you do. It's just a way that you need to go forth and share what you have. And relationship building, we have the state health departments. We all have our surveyors. Some of us have favorite ones, if you're lucky to have the same ones reappear in your building every year, or your state dietitian. It's always very nice to establish a relationship with your state dietitian. Also, if you have the opportunity to participate on any of your state legislation's committees, a lot of them have a health committee or an aging committee, and quite often they're crying for people outside academia or outside of the political realm to come in and talk about, as a layperson, about what you do in your job in food and nutrition. So that's an awesome place. Allied associations, every state has a chapter of the American Healthcare Association, AHCA, and has a leading age. So reach out and contact them. Talk to their government affairs person. If you have an opportunity, try to set up a luncheon or a coffee, or so that you can have maybe some of your board members go with you and you meet your allied association government affairs people. And like I said, just the public, any opportunity you have to share what you do, that's always nice. My son is graduating from high school, and the high school here has a wonderful culinary arts option. It's kind of grown from the old home ec days, and they have a cafeteria, and his friend asked, can you come talk to us and tell us about healthcare? A lot of us, all we think is, chef, and some of us might want to do something else. So that's an avenue to get out to the young people. So how do we do these initiatives? Maybe you're not so comfortable with the public speaking. Maybe it's better if you write letters or send emails. or we'll talk about later in the slides being tagalongs with the allied associations. Reach out and encourage participation from your own membership. So I know a lot of the allied associations have forms that they have people send out where they'll reach out and they'll say, you know, do any of you have any legislative ties? Maybe it's a family member that just, you know, got on a committee or a board, or maybe your relatives, the governor of the state, who knows? But, you know, reach out and try to find those individuals that can help you go out and influence and get the contact with these people. And then I think the biggest thing that we have to do on a regular basis is we really need to share what we're doing, what we've learned with our own state ANFP members. I like to see a column in the newsletter, or if you send out blast emails, if something is coming up and you want to share that with your group, make sure you get it to them. Attend your chapter board meetings. You're a viable part of the board. Share what you have. Ask their blessing if you need to take a road trip. Maybe you've been asked to tag along with your healthcare association to an outing, either in DC or whatever. You know, ask and see if there's funds in your chapter to help get you there. Or if you're going to travel a distance, you know, you can work with your chapter about maybe if it's drivable and you want some mileage money to cover the cost of driving, let them know that you're going to this. Or even a lot of times it's when we have town hall meetings, when our senators and congressmen come back to their states, they like to do some sort of town hall meeting. And if your healthcare community is big enough, maybe you can offer up your auditorium. Or even if you're, you know, partnering, part of your organization has the ability to share with a hospital that has a bigger auditorium, maybe you can offer to have your members help set up this town hall. And, you know, everybody likes some sort of snack, so maybe you offer up that, you know, we as dietary managers, we would love to provide the snacks and the beverages for the town hall. But once again, make sure you keep in communication with your board and your membership. And the same thing, if you're going to your healthcare associations, either Leading Age, Hospital Association, ACAs, you know, they have their annual meetings once a year. Maybe you ask if you can have a booth. Sometimes the vendor pricing can be prohibitive. Sometimes it's too pricey. Talk to one of your food vendors and say, can I have a little corner? Can I share a little corner of your booth for free? And maybe have some flyers or information about what it is to be a CDM CFPP, or talk to your colleges that might offer the education and ask to go with them anytime they have a job fair or something, that you can, you know, get out there and share and promote the CDM CFPP. And then yearly we have the Government Affairs Award that your state chapter can apply for. And this generally is the spokesperson that will review with your chapter president and help you fill out and apply for this Government Affairs Award that gets handed out yearly by ANFP. And if your chapter is applying for the Diamond Award, then the Government Affairs Award needs to be filled out as one of the precursors or the criteria to actually run for the Diamond. And the deadline for that is March 31st. And talk to your chapter president. They can access the documents. They're on the ANFP website under the chapters that talks about all the awards that can be applied for. So this is kind of some of the official roles. So let's break it down. We talked a little bit about the policy, legislation, regulation, and best practices. My favorite one on here is the green best practice. A lot of states are unaware of this, but your state survey entities and usually your governors like to promote nursing homes best practices. And so a lot of us do initiatives within our facilities that we don't really get credit for. So I've seen best practices in different states where the facility has submitted to their state, either Departments of Inspections and Appeals or Health and Human Services, a best practice saying our facility ABC has donated food to the homeless, or we feed a free meal once a month, or we helped do sack lunches for the weekends for the children of the community. It could be lots of things that your facility does. It's food related. That could be a best practice, and that you as the spokesperson, you could say, hey, I didn't realize that Betsy over at Fairhaven, her facility got a best practice for this. So when you go out and talk to, other members and other associations, say, oh yeah, we as dietary managers, we promote best practices, and we've been recognized through our state survey entity under the best practices. So take a look at that. Not every state has the best practices, but the majority do. So kind of fill that out and see if your state survey entity, solicits best practices. So policy can be many things. It can be maybe your allied association has different policies that they write for their members. It can be policy in your state legislation. It can be policies on the national level, but any type of policy that relates to food and nutrition, you can help support. It might be your consulting dietitians. It might be the Academy, AND, the Academy of Nutrition and Dietetics. But we can help influence policy, or we can help participate if there's any policies that have to be written. It could be your corporate entity that you work for is trying to write a new food and nutrition policy, and you want to help, so you can solicit from your members in your state and say, hey, Acura Healthcare is going to try to write a policy on food brought in from an outside source. Can you guys help me? And let's give them some examples of other communities that have done this. So that's a way that you can be the brand ambassador. Now, legislation and regulation, they go hand in hand. Legislation, it can be what we've already done, getting the CDM, CFPP approved through CMS and put on the federal level. That has been awesome. That's kind of a stepping stone now where we're heading, to get the states to recognize in the state-specific regulations. So maybe changing legislation when you go as legislators to review all your state's healthcare regulations and align them better with the new CMS regulations that started back in 2016. Maybe that was the time to talk about, could we maybe get the CDM written or listed as the top option? So once again, legislation, regulation goes hand in hand. We can improve, promote it, we can encourage it, we can create it, as you've seen. And then, like I said, just getting things solid so you have those relationships. Now, I didn't talk much about the impact teams. Part of the spokesperson's duties in the states is to lead an impact team. And an impact team can be smaller groups of CDMs that gather throughout your states. I don't know if you can talk about impact if you have district meetings, how your state does it to break out into smaller groups. But you can have an impact group where you maybe have your members. We have 5 impact areas in Iowa that we have built the state up so that we have a chair in each impact. So if I've got something going on in the northern part, I know who to contact. Or if they have something going on and they say, hey, Barbara, as spokesperson, can you come and help us address this, or something local? It might be the health inspector. But it's a way to have smaller groups out there that you can utilize in your chapter to help you impact regulation or legislation, and a way to educate in that quadrant. But like I said, be sure and check your chapter's policy and procedures, because you might have specific duties, you might have specific term limits. I know in Iowa we have a 3-year term, and it's approved by the board. So every 3 years they ask if the spokesperson wants to continue. If not, then a new one comes in. But it's kind of like not voted on in Iowa, it's an approved position. So that's kind of different. And like I said, make sure you check with your state's policies and procedures and have a copy. You should have a copy of your duties, and it should be looked at yearly to make sure that it doesn't need tweaking. So we talked about tag-alongs. I absolutely love tag-alongs because it's always nice to get with other associations and see exactly where their thought process is. So there's healthcare associations. I know it used to be, they used to do like a Charge the Hill in March, where the American healthcare associations, they would ask their chapters to all converge on Capitol Hill, and they would have a set agenda of items they're looking at. For the past many years, probably too many, it's been the impact of Medicaid and Medicare on the rates for nursing homes. But they would ask, who wants to go along, and they would kind of get a rallying call out to their members, and they would charge the hill. Leading Age has something called Make a Difference, and that's kind of cool because they've chose, Make a Difference days. It could be in their states, it could be, at the federal level, but they do that. The Academy of Nutrition and Dietetics and the dietitians and healthcare communities, they have like take action. They'll have actions alerts. They do it as well, and it's kind of fun to go with the dietitians. You kind of see both sides, those that are in healthcare and those that are in the public sector, and it's kind of fun to get signed up. I know I'm on an action alert anytime they have anything that they want us to contact our senators or congressmen about nutrition-wise. They'll send an alert, and then I can go on and follow the instructions on the email and help promote nutrition. So take the opportunity to do tag-alongs. Figure out what your state has and tag along, either to, Capitol Hill in Washington, D.C., or to your state capital. So here's how you kind of get to this information. ACA has their general website. They always do a briefing at the end of the year, so you can see what the 2017 briefing was. They should be getting ready to put out their 2018 items if it's not already posted. They talk about advocacy. They have a tab for that, and they'll let you know when are we doing our big surge and what topics are we using. Leading Age, Make a Difference. They just had in Florida, this is off the Florida Leading Age page, they just did a Make a Difference advocacy or legislative days last week in Tallahassee, where their capital is, and they invited members to come and do some 2 days of advocacy in action training, and then I believe they visited the Capitol in Tallahassee. I myself, the Iowa Academy of Nutrition and Dietetics is having a legislative workshop, and it's free. So I've already signed up for February 28th, and part of that is we spend 8 hours together talking about advocacy and things that we need to promote for nutrition, and they're setting up appointments, so we might be able to visit the chair of the Health and Human Services. They're trying to get some time with the governor, so they're setting up that, and like I said, I got the email, I hit register, and I'm in like Flynn, so I'll be attending that with the Academy, which is nice, and it'll be a blend of both the healthcare dietitians and the dietitians outside of healthcare. But these are ways for you to go and be part of a group, especially if you're new to the spokesperson role. You might want to get your feet wet by tagging along with somebody else, and then just making sure you have materials with you that you can share about what is ANFP and what does a CDM do. So that's just a great way to get moving, and it's also a good way, I like to say, January, the first quarter of the year, that's when other associations are just starting to figure out. They've vetted all the complicated regulations that are either going through Capitol Hill or going through their own state. Budgets have been approved. A lot of stuff in that first quarter is looked over, and it's, once they've kind of gone through it, then you kind of have an idea too of what's the big perspective for our residents in our state, based off of what the trade associations have found out, leafing through the pages and pages of regulations. So here's just some examples. Cindy Cawthorn is a spokesperson from Kansas, and she also is on the Government Affairs Committee. She has a What's Up Washington always has a column in there across the Prairie newsletter, so that's awesome. I love using our Facebook in Iowa, our Facebook page. It's kind of a cool thing to watch how many people have liked it or read it, or, you can kind of see how many people it's reached. So, back in September, when we knew that the regs had passed the mustard at the federal level, it was kind of nice to post something just to let everybody know, hey, this is, we did it, we made it. So those are two quick ways for you to communicate, whether you're, we do 4 newsletters a year in Iowa, so that's 4 columns, and then outside of that time, you can post on Facebook, or you can tie into, if your chapter president has any monthly updates or whatever, you can tag along on that, just to kind of keep what's going on in your chapter front and center for your members. So the ANFP Government Affairs. I got a shout out. I know I've got Sue Rinkenberger and Yvonne on the phone, or they're listening in today, so that's awesome. We have the opportunity this year to make a difference in promoting the CDM CFPP. We have it in the federal regs, so now we're going to take a look at what are the state regs saying, what are they doing. So Mindy is the person at ANFP that's our contact for the government affairs and for the spokespersons. And so she and I got together and we brainstormed, and we came up with this rallying cry: CDM's Cultivating Roots. And the ROOTS stands for Rallying Organizations and Officials in Training Standards. And that's what we're asking to do. We have the CDM, the Certified Dietary Manager credential, approved, as well as the CFPP, the Certified Food Protection Professional. So now we want to take it a step higher and say, okay, we need to talk more about what does the CDM CFPP do? How good is the CFPP? Let's talk a little bit more about that in states that have a sanitation requirement. Now that the federal government has come forward and recognized the CDM and the CFPP, where do we stand as a state in regards to an added sanitation and food safety criteria? Where do we have in our state language that the CDM should be the Director of Food Service? Usually what happens, and this is the way a federal regulation is, as long as the federal regulation is, as long as your state regulations equal to or more strict than the federal regulation, then you will go with the state regulation. But once the federal regulation is tougher than what you have on your state level, then that's the one you go with. So right now, any states that have state-specific nutrition information that does not list, that maybe just says you have to have a sanitation degree of some sort, that is not strong enough. The federal reg will trump that because it is more strict to have the CDM CFP than, for example, to have a ServSafe certificate. So that's kind of what we're looking at. We're looking at getting the organizations and the government officials and the states to look at training standards. So that is our rallying cry, and we're going to go forth in 2018 and promote that on the national level. Okay, let's see here. So here is your government affairs team. I'm on there. Cindy Cawthorn's from Kansas. We got Yvonne Foyt from North Dakota. Jeremy Manners is from Pennsylvania. We got Randall Menard from Tennessee, Sue Rinkenberger from Illinois, Thomas Schoenwald from Wyoming, and then we have Mindy Teesfelt as our ANFP staff member extraordinaire. She's doing an awesome job. And then we have Craig Brydup, our Washington, D.C. representative. So a pretty strong team. We'll be working with you. We've talked about, in fact, the government affairs team will have a meeting tomorrow, and we're going to be talking about our rallying cry, the roots, and then at the same time, we're looking at mentoring. So as a government affairs team, we're going to reach out to the spokespersons and mentor in your state. And we pick the states that do not require the CDM. So these are states that have no state regulatory language that talks about the CDM being the Director of Food Services. And we just kind of want to add that into states legislation because we have it at the federal level. It will resonate, and we want to have the same verbiage in our states. So right now, Yvonne's got those states. I've got the states, Connecticut, Massachusetts, New Jersey, Rhode Island. So we've kind of just picked the states that don't have the reg. And then as a committee member, we're going to be reaching out to the spokespersons in that state, and we're going to enlist their help to help impact, help influence, help change the state regulations. Because right now, with all the new regs that the federal government has thrown at our long-term care facilities, all the states are having to review their state-specific healthcare regs. So now's the time to say, hey, while you're changing it to list QAPI, or while you're changing it to add that infection control position, could you just write in for the dietary, just take the language from the federal and add the Director of Food Service needs to be a CDM, CFPP, and once again, we're going to mentor the states. We've got information that we can share with you, but we're hoping that by having that extra layer so that we can go to the spokespersons, we can be that spark that ignites you and helps you wade through the waters of legislation, that we can get things changed and get some of our verbiage written into your state regs. So some other things we're doing at our level, we're working on a spokesperson toolkit. So you can see under construction, we're reviewing and finding items to put in there. And when we have that, we will send out an email to the state spokespersons letting you know that you can now go and access these tools that will help you go forward. As a government affairs committee, we are also working on another initiative. It's called Education in the Workforce, and it's something going on Capitol Hill. It's a bill that's moving through Congress, and what it has to do is it's trying to strengthen training in the technical education field. So I know a lot of you have heard, we do not have enough carpenters or plumbers or welders. A lot of these 2-year degrees or technical degrees at our community colleges are slowly dying out. So the government has taken notice of this and said, we need to promote this. And the dietary manager courses are at your community colleges, and they are a viable education for someone that doesn't want a 4-year degree. So we are part of, we've joined this initiative. We also have people on the committee from ANFP, so we have a voice there. So once again, we're promoting as an association schooling for the CDM, because I know that's one of the things you guys are going to encounter when you go out into your communities or talk to your allied associations. The cry for we need more CDMs. There's not enough out there. And it is so true. We do not have enough CDMs. And as of November 28th of 2017, anyone hired after that date has to be a CDM. That's the way the rules read. So facilities that do not have a CDM and that are hiring one, they're already out of compliance if they choose someone that's not educated. Now, that doesn't mean the person hired can't be successfully going through a program, but until they've completed the program, the facility is considered out of compliance. And that's just the way the federal regulation reads. So, knowing that we need more, we as an association, we hear the cry and we're working on that. So, that's one thing. Be prepared for that. We need more of you. How do we get more of you? And that's one thing we're working on. You can, as a spokesperson, promote the educations either online or through your community colleges, saying, we see this need and we're working towards that. So when you want to look for resources, ANFP is your spot. We have the resources there for you. On the ANFP page, there's the advocacy tab that you can click on. That will take you to the government affairs, and that will get you involved in looking at documents or Q&As on how to go out and go forth and conquer. Some of the things you need to know, when you go forward and you start promoting as spokespersons, you need to know your stuff. You need to know what the CDM, CFPP stands for. There's documents that are great PDF one-pagers that ANFP has put out on the web. And so here's ones from the CBDM online, and that's the certifying board's specific website that you can get to from the ANFP site. But there's a career guide that talks about what is a career to be a CDM. You should always have a copy of your scope of practice. I love presenting that form, even to dietitians. I think it tells a lot about what our competencies are as CDMs, because that is our competency checklist. So have a copy of the scope of practice and know the scope of practice. And then there's all these promotional videos that are just short clips that talk a little bit about it. If you get a chance to do a presentation, pull these up, show these. This is a good way to lead and say, this is what we do, especially if you're speaking to potential students. Did you know? I help teach at a community college, and I have to share the kitchen with the culinary students. And they, we'd come tootling in on our aprons and our hairnets, and they run around their big chef hats and they stare at us for a while. And then after like 2 classes, then they start coming into our little kitchen area and wondering what we're doing. And it's always fun to talk to them and say, especially the older chef students that, maybe don't want that type of life where it's, 7 days a week and odd hours. Then we start saying, well, we have chefs in nursing facilities, or CDMs that, have a 401k and have vacation and are able to have set hours and able to be creative. And what better way than to make, put smiles in the eyes of all the residents. It's just a very fulfilling career. So, that's a way that we can sell it as well. And the big thing is you need to share your story. When you do go out, talk about what you do. Tell them about how you so enjoy being able to brighten someone's day by coming out with a cup of coffee and some homemade cookies. Or a resident comes with a recipe that's been in their family and they want to know if maybe you could make that for, an activity or something. But go out and share, what the CDM does. We're there day in and out with our residents, improving their lives. So don't be shy. Make sure you tell your story and make it a personal one. That's what sells. That's what sells when you go to your legislators, your senators, your congressmen, because I tell you what, some of our congressmen and senators are old enough that they could tomorrow be checked in to some of our facilities. And I always tell them, I'm trying very hard to make it better so that when I get there, I'm a coffee freak. I want coffee and bonbons. I want to have a choice. I hate breakfast. I don't want to get up for breakfast. But if you hit me with a cup of coffee about 10 o'clock, I'm good. So I always tell them, it's nice to have a story. We had a congressman that his brother was in the facility. And so when I would go talk to him, I knew the facility. I knew the dietary manager there. And he'd always say, my brother's taken such good care of. They let him wear his bib overalls. We have to yell at him because he doesn't want it to be washed. But, there's all these personal connections. And if you get someone that's a little bit maybe standoffish, you might say, well, what do you want when you get old? Would you like to make decisions? We're helping them make decisions on a daily basis. So being able to share your stories and talk about, that's why we ask our members, do any of you have any affiliations with senators or congressmen? Because those are kind of stories you can pull in. So don't be shy. I guess the big thing here is we want you to know, as a government affairs committee, we're here for you. We want the spokespersons to be successful because we truly now have skin in the game. The CDM credential being recognized by the federal government has given us a new and even brighter horizon than we had before. We need to go out and let them know that we're proud of what we do and that we're promoting it and that we want to make a difference and keep making a difference. So that's the spokesperson's rallying call, is you're going to go out and you're going to make that difference. And then pull your chapter with you so that they can help you. So once again, don't be sitting on your questions. If you got them, reach out. ANFP has now opened a new email address for just regulatory questions. So it's regs@anfponline.org. That will come straight to me. I get to dabble in those on a daily basis, which is awesome. When we start the mentoring, you'll be hearing those states that were listed on the mentor. You will be hearing from your government affairs liaison. Just give them a little time. Like I said, tomorrow we're having our first of our 2018 meetings with the Government Affairs Committee, so you'll be hearing from them. So, like I said, any questions today, ask. Watch for the toolkit. Mindy and I are working on that and getting some stuff put in there. Take a look. Now's the time to look at your associations for Tagalongs. Start planning those. Like I said, usually some are March, some are May, but see if you can start making those relationships so you can start promoting in your state. And if you have the opportunity to go to Washington, D.C. with your allied associations, that is an awesome trip as well. So any questions, we'll go ahead and take those. The next chapter chat is a big town hall meeting that will happen the 20th of February. So once again, Abigail's wanting any chapter related questions. If you've got any for the town hall, go ahead and get them sent to her by the 13th, a couple days before Valentine's Day. So let's go ahead and let's go and see if we can take some questions. So I will turn it over for questions.
Thanks, Barb. Any questions out there? Barb really covered a lot here. I definitely know it was very informative to me. So if there's any questions, we'd love to hear them now, or certainly you can follow up with either Barb or I after the call as well. I'm curious, Barb, as somebody who's starting out in the spokesperson role, where should they begin? There's a lot of information out there. What should they prioritize?
I would say the big thing is you need to look at your chapter's description of what is required of the spokesperson. And then I would take a look and say, okay, if my corporation or my facility is already a member of, say, Leading Age, then I would start looking on their website and say, what are they doing for advocacy or American healthcare? See what your state is doing. You can also go into your state's Health and Human Resources, and you can see what is on the docket for healthcare. What are they talking about for Medicare and Medicaid? And then take a look at your state-specific healthcare regulations. What do they say for nutrition? I think some of us, it's a good place to start, because you might be surprised that they might list like the 1998 food code, and you'll be like, holy buckets, that's someplace I need to go in and make a difference. We need to have the most updated food code listed. No wonder the surveyors aren't doing the best, those kind of things. But I would take a look at first what your state policy and procedure is for the job role of a spokesperson, and then look at your state specific healthcare regulations for nutrition, and then see what you can do for some tagalongs and introduce yourself to the allied associations.
Great. That's a great place to start. Do we have any other questions out there, comments?
Hi, this is Dorothy from Minnesota, and I just want to say that well done, team. You know, as you know, I've been a part of this organization for a long time. You've given me new tips and new ideas and some of the things that I'm doing to support our chapter members. And I just want to say job well done.
Well, ditto, right back at you. I say persistence pays off in this role. You just have to be polite and persistent. So I tell people your P&Ps, politeness and persistence.
That's right.
Yes, absolutely. What are some ways that our spokespeople can get their foot in the door with some of our state legislators?
I would say you really need to research first to see who is the leader of the pack. Most of the time, you're not probably going to get in to visit your, it might be you might get a better audience with your local mayor. You might not get in with your governor right away, but find out who is leading the healthcare policies or the Health and Human Services committees. A lot of times they might be a nurse, and then you have an in. So I say always do well research, find out who they are, and then figure out, does anyone in my chapter have a relationship that can help me out? Or can I just go and, make a phone call? A lot of times, we live and die by emails, but unfortunately the email box can be a good thing and a bad thing because too many come in and triaging doesn't always work. So it might be best to pick up the phone and find out who that committee member is and give them a call and say, hey, do you have 5 minutes? Or, hey, I'm going to send you an email. That might be a good way too. But your trade associations, they're bigger and they're usually stronger. So getting an opportunity to go in front of, say, your local leading age advocacy person, that's usually a smaller office, and you can go in and say, hey, can I have a 15-minute chat with you, or we set up a meeting and I come in and talk about what I want to do with food and nutrition in our state, and can you help me as a trade association? So that might be a good place to get the relationship going.
Great. And now this is, quite an undertaking, and I know this is a volunteer role for all of our spokespersons. So what's the way we can kind of help spread this word? How do we tell or ask our chapter members to take part in this? Because really, it is quite a group effort.
We've done things in the past where we've done letter writing during our annual meetings. So when our chapter has its spring and summer meeting or a fall meeting, we've written thank you notes and had the members write thank yous to their congressmen or their senators. And then we break them up into groups and say, well, those of you that live in Senator Ernst's area, go ahead and we'd like to thank her for something good that she's done. So we'll find a piece of legislation that they've promoted. And then we send them a thank you card. Or you can do a group letter writing campaign where you as a spokesperson, take action and you start a letter and you can get your members to click and send it off. They can type something personally, but you can start to take the action campaign and rally them, and they can go ahead and participate. So that's something that they can do in front of their computer, and maybe they didn't realize that there's a new Medicaid state initiative going on, and we want to support those kind of things because they bring dollars to our facilities. So that's a good way to do it. So like I said, writing an article in the local papers or having your members do that. You could say, I know that your senator's having a town hall. I saw it's going to be in your neighborhood. Do you guys have time to go? Can you go sit in? Maybe just leave them your card. When you shake their hand, have your business card and give it to them. And, I tell people anytime you can wear anything that says I'm a CDM, or if you have it on your name tag, wear those things when you're out in public at those type of meetings so they can see what it is. A lot of people are curious about the initials behind your name. So be able to share that.
Great. All right. Any other questions out there for us at this time? Okay. Well, thank you, Barbara. Thank you so much for your time, sharing this information. You clearly have a wealth of knowledge about this, so I do hope that if there are questions, our members do plan to reach out to Barbara to follow up. And of course, this is recorded, so we'll be sending this out to the other chapter leaders that were not able to attend today. So again, thank you so much, Barbara, and thank you all for joining the call. And if you have any other follow-up questions, feel free to reach out to me or Barbara. If not, hopefully we'll see you at the next, or hear from you at the next chapter chat on Tuesday, February 20th. Thanks so much, everyone. Have a good afternoon.